Many people are referring to this as the second wave. The next guest refers to it as the third surge. Sauer joins us now, Johns Hopkins Assistant Professor of Emergency Medicine. Professor, great to catch up with you. Why is that a better way of understanding what we're going through in Europe and the United States currently?
I think we saw that first wave very early in the pandemic, and across the U.S. and in Europe, we've seen second surges in cases. And I do like thinking about this as the third surge because I think it is moving into fall. It is moving into flu and other respiratory virus seasons. And I think we will see that increased number of cases, that pickup again, that is going to be potentially very serious. And that reminder that this is the third time we've seen this. We have tools in our toolkit to mitigate it and to fight the spread, and we have to use them now.
Well, that really leads to what I wanted to ask, which is we're seeing record numbers of cases in Germany and France and in places in the Midwest in the United States. Is the third surge going to be much worse than the first and the second in terms of both virus cases as well as deaths?
The numbers are definitely ticking up and are very concerning. There has been a lag, or there have not been as many deaths, but we do tend to see a lag in deaths versus hospitalization of cases. We're also seeing with some of the recent studies that are coming out that the hospitalized cases are of younger, healthier people, which is concerning. And so keeping an eye on how people behave is going to be really important, especially as we move into those holiday seasons where people are going to be potentially gathering with individuals that they haven't been spending time with. They might even be adding travel to their daily routine. And so having this situation where hopefully we see a decreased number of flu cases because of these social distancing, these masking and other activities that we've been doing all summer, that we still have the potential to have two viruses coupled together, increasing the case and the burden on our hospitals.
Lauren, just when it comes to the seasonal flu, certainly not much travel between the southern hemisphere and northern hemisphere this year. Does that affect the spread of the seasonal flu, and could it be a lot lower this time around?
The numbers are looking lower from the southern hemisphere. We don't know really what that will mean for us yet. We're at the very tip of starting flu season here. I think everyone is hoping that both the travel restrictions and the shelter in place, social distancing and masking requirements will lead to a fewer number of flu cases. There's also a significant increased push to get people to get their flu vaccines, which I think is good. It's sort of a wait and see situation because there have been relaxed restrictions, earlier in the year, and there's relaxed restrictions in many cases right now, which is why we're seeing this third surge of COVID cases as well. So I think we're all sort of hoping that that's the case, that that's what happens, but we'll have to wait and see.
Lauren, just quickly, just a final word. You mentioned air travel. The risks around air travel, there's been some conflicting reports and some research done on that recently. What's your take on things?
I think the research looks very positive. I think we're seeing that that air travel is actually quite low risk. Those studies that have recently come out do not factor in a lot of the human behavior. So that being said, we see few outbreaks associated with air travel now that masking and keeping that third seat is happening in a lot of places. So I think it's promising data, to say the least.